Hi all. I'm Dr. Raja Krishnan. I'm an assistant professor working in SNS College of Physiotherapy. We are now going to discuss about an wonderful DT-based video on the heat stroke. You may hear it of the term, the heat stroke. Why? Because we are taking the heat stroke this month means this month is the starting of the summer. So in your people surrounding around your areas or your in your families in your friend circle, you can discuss it about the heat stroke and you can take a preventive measure against this heat stroke. These are my mentees from third years. They are going to present a wonderful DT based video on heat stroke. Now we can start with Ms. Devika.
Hi, I'm Devika. I'm studying third year BPT. Today I'm going to talk about heat stroke, a serious and potentially life threatening condition caused by excessive heat exposure. Heat stroke occurs when the body's temperature regulation system fails and the core body temperature rises above 40 degrees Celsius and 104 Fahrenheit. It is the most severe form of heat related illness and requires immediate medical attention. Normally, our body cools itself through sweating. However, during extreme heat or prolonged physical inactivity, especially in hot and humid environments, the body may lose its ability to regulate temperature effectively. Common symptoms of heat stroke include high body temperature, hot and dry skin, confusion, dizziness, headache, nausea, and sometimes loss of consciousness. If untreated, it can lead to damage of vital organs such as the brain, heart, and kidneys. People at higher risk include the elderly, children, athletes, and those working outdoors, particularly during peak summer months. In conclusion, heat stroke is preventable by staying hydrated, avoiding excessive sun exposure, and taking proper precautions during hot weather. Thank you.
Hi, I'm Smriti of SNS College of Physiotherapy, and I'm going to talk about the causes of the heat stroke. Environmental causes: exposure to high temperature, high humidity reduces sweating effectiveness, and poor ventilation, closed and hot rooms, heat waves, etc. Another cause might be exertional causes like heavy physical activity in hot weather, sports or exercise in high temperature, working outdoors like construction and farming, etc. And the major cause is dehydration, inadequate water intake, excessive sweating without fluid replacement, etc. Clothing factors: wearing tight, heavy or non-breathable clothes, protective gear that traps heat, all could cause heat stroke. And age related causes include elderly people which have poor temperature regulation, and children we have that have immature thermoregulation. And drugs and medications: anticholinergics like reduces sweatings, diuretics causes dehydration, antihistamines and alcohols. Medical conditions like obesity, heart disease, diabetes, infections with fever can cause heat stroke. Thank you.
So I'm going to speak about the clinical features of heat stroke. The first comes the high body temperature. The core body temperature will be in 40 degrees Celsius, which is 104 Fahrenheit, and the skin feels very hot to touch. Second will be central nervous system symptoms. The first would be confusion, irritability, dizziness, delirium, seizures, and loss of consciousness. They'll go to coma stage. And then the third would be skin changes. The skin will become very hard and it will be hot and then dry to touch, and then sometimes it will be very sweaty, and then it will be flush, which is reddish appearance. And then the fourth would be cardiovascular changes. In cardiovascular changes, they'll have tachycardia, which is increased heart rate, and then hypotension, which is low BP, and then weak pulses. So next would be respiratory changes, in which they'll have rapid breathing, which is tachypnea, and then hydration features, which is dry mouth, thirst, reduced urine output. So then they'll have gastrointestinal symptoms, which will be nausea and then vomiting. And then, which if this condition, it if advances and it is very severe, it will be like very complicated, and it will lead to multi organ failure, and then kidney failure, liver damages, and disseminated intravascular coagulation. Thank you.
Hi, I'm Ritika Sri from SNS College of Physiotherapy. Investigation: basic test, core body temperature, rectal preferred, blood pressure, pulse, respiratory rate, blood test, complete blood count, CBC may show the leukocytes, serum electrolytes, sodium potassium imbalance, renal function test, increase in urea and creatinine, liver function test, increase in AST and ALT, blood glucose, hypoglycemia may occur, coagulation profile, PT-INR, to check for the DIC, dissemination, intravascular coagulation, muscle damage, creatinine kinase, CK, increase in the rhabdomyolysis, urine examination, myoglobinuria, dark urine, arterial blood gas, ABG, metabolic acidosis, ECG to detect the erythromyosis, treatment, medical emergency, start immediately, rapid cooling, most important, cold water immersion, best method, ice pack on the neck, axilla, groin, cooling blankets, evaporative, cooling, spraying water plus fan, supportive care, airway, breathing circulation, oxygen if needed, IV fluid, normal saline, medication, diazepam for seizures, avoid antipyretic like paracetamol, not effective. Thank you.
Hi, myself Amir. I'm here to tell about prevention of heat stroke. Heat stroke mainly appears due to climatic changes. To prevent, a basic need is proper hydration. Drinking frequently waters, cold water can prevent the heat stroke, and avoid heat exposure. Avoid outing during noon times, and light clothings. Wearing a light cloth can prevent from heat stroke. Accumulation, a proper timing to go out can help in prevention in stroke, and a proper diet can help in prevention. Eating light food and easily digestible food can help in heat stroke, and frequently taking baths can prevent heat strokes. Thank you.
Yes, you made an excellent video about an heat stroke and what are the prevention, what are the causes, clinical features. We did an elaborate discussion about this. It is good. You have to inform your surroundings. You have to prevent your surroundings and family and friends with this heat stroke. Will you do what you learned from here? Yes. We can give another excellent video in the next part of the series. Thank you.